Hi, my name is Agata and I'm a psychological wellbeing practitioner at the private therapy clinic. In this video, we'll be talking about borderline personality disorder, also known as emotionally unstable personality disorder, and complex post-traumatic stress disorder. Now, these two disorders have a lot of overlapping symptoms and can often be confused for each other, but they are actually inherently different. So today we'll be discussing how they're diagnosed and what kind of treatment will be recommended for them, as well as their similarities and differences. You'll likely have already heard of BPD, and as the name suggests, it's a personality disorder and can affect lots of different aspects of your life. Some of the main difficulties include interpersonal difficulties, difficulties with emotional regulation, anger problems, also a chronic feeling of emptiness and an unstable sense of self. Now, this is also followed up by self-harm and suicidal ideations or tendencies, which can often present in many clients as well. With BPD, although there is some sort of genetic component behind it, meaning it can be inherited, a lot of the time people who are diagnosed with BPD have had some sort of long-term trauma in their life. This can be in their childhood, for example, neglect or abuse, but it can also be developed in adulthood from difficult relationships. However, this trauma isn't essential for the diagnosis of BPD, whereas with Cptsd, it's actually an essential part of the diagnosis. So Cptsd, as the name suggests, it's a type of PTSD. With regular PTSD, the trauma comes from episodic events, meaning they happen once or twice, and then you develop the post-traumatic stress disorder. Whereas with complex PTSD, that trauma is long-term and develops over a longer period of time. Like I mentioned, there are a lot of overlapping symptoms. So if you suffer from Cptsd, you're also likely to have interpersonal difficulties or difficulties regulating your emotions, and you may have extreme mood swings and anger. However, you're less likely to have that fear of abandonment, and you're also likely to have a negative sense of self rather than an unstable sense of self, which means you perceive yourself negatively. Whereas with BPD, you may not have an idea of who you really are. We also can't rule out comorbidity because you can actually have both BPD and Cptsd simultaneously. However, this is quite rare. When it comes to diagnosis, it can be quite tricky, not only because these disorders can be overlapping and can be confused for each other, but also because the psychologist needs to uncover an accurate history as well as the individual's sense of self. Now, this can be difficult for the individual themselves to identify, so psychologists need to take the time to figure out these things to get an accurate diagnosis. The main goal for treating Cptsd would be for the individual to get over those traumatic events that they experienced and have a more positive sense of self. Whereas with BPD, the main goal would be to stabilise that sense of self. And then, of course, for both of them, it would be to treat the difficulties that the individual may be experiencing, such as interpersonal difficulties or emotional regulation. Some people may be interested in medication, in which case that is an option. However, there hasn't really been a medication that's been developed for either borderline personality disorder or complex PTSD. And this is likely because a lot of the time they do stem from traumatic events. So therapy is most useful. However, if you were interested in medication at any point, that's still an option, and you can get medication for one of the symptoms or some of the symptoms that you may be experiencing, such as anxiety, low mood, or psychosis. Let's talk a bit more about diagnosis. So diagnosis isn't essential to get treatment, but it can affect the treatment you receive and how effective it is. For some people, diagnosis may be beneficial, as they may feel like they understand themselves more and they understand their disorder more. However, for some people that diagnosis may feel like a label, and it may be a bit stigmatizing, especially because BPD and Cptsd are severely misunderstood. Whether you choose to get a diagnosis or not is completely up to you. However, do keep in mind that it can affect the treatment that you receive and how effective that treatment is. An example of this is that for Cptsd, we highly encourage the individual to engage in the trauma that they've experienced so they can heal and recover from that trauma. If you have BPD and you engage with that trauma or with any trauma that you've experienced at the beginning stages of therapy, you may feel a lot more angry and you may feel like you have an increased amount of mood swings because of that unstable sense of self. So you do have to be quite careful when approaching treatment, and if at any point you do feel triggered or you do feel like your symptoms are getting worse, it's important to let your therapist know. If you do choose to go down a therapy route, the therapy we most recommend for both of these disorders is Dialectical Behaviour Therapy, or DBT. DBT will teach you essential skills that can help improve your everyday life. It will teach you things like emotional regulation, distress tolerance, interpersonal skills, and will use techniques like mindfulness, meditation, and journaling to help with this. It's recommended that DBT lasts around a year, and you can see a therapist on an individual level, or you can also join a DBT group. Now with DBT, it's important to note that cutting therapy short may be quite difficult to handle, and it's recommended that a person engages in therapy for at least a year. For Cptsd, this isn't necessarily the case, and you may be able to end treatment earlier. This is mainly because people with BPD suffer from that fear of abandonment, and that might be triggered if you do stop therapy too early. Another type of therapy that can be used is mentalizing based therapy. This is a therapy that can help you with your emotional regulation and also interpersonal skills. A third type of therapy is transference focused therapy. This focuses on your relationship with your therapist and how you interact with them. You can then learn interpersonal skills from this and apply them to your everyday life. Whether you tick a few boxes or all the boxes for either of these disorders, or if you've experienced childhood trauma or not, it's important to look at the symptoms you're experiencing or the difficulties that you're experiencing and see how they can affect your everyday life. By doing this, when you approach therapy, you'll be able to set yourself concrete goals for the therapy. For example, if you're having difficulties in your relationship, that's one of the key aspects that you can work on with a therapist. Your education, your work, or your family life might be affected, and it's important to reflect on these things. By building a relationship with your therapist and working on these goals, you'll be able to improve your quality of life and deal with your difficulties a lot better.